Hi, I'm Dr. Bill Cushing, and today I'd like to continue our HIPAA high-tech discussion and talk about protected health information, or PHI. Protected health information means individually identifiable health information that is, 1, transmitted by electronic media, 2, maintained in electronic media, or 3, transmitted or maintained in any other form or medium. In 2016, there were reported 325 large data breaches of protected health information, comprising over 16 million patient records. The year's single largest breach was for just over 3 million records. 40% of these breaches were a result of unauthorized access and/or unauthorized disclosure. We all know that hacking is on the increase, and these numbers will certainly increase, as will the financial liability of the covered entities associated with the breaches. When PHI, or protected health information, is shared or disclosed, you have to be careful. PHI can naturally be shared within the practice that holds the information, but disclosing this information outside the practice requires that the practice disclosing the information limit the information to the minimum necessary for the intended purpose. The sharing and disclosure of PHI are permitted for a patient's treatment, payment, and healthcare operations. And we refer to this as TPO, treatment, payment, and operations. Treatment involves the rendering and coordination of a patient's care. Payment refers to the exchange of information between the practice and payers. Healthcare operations includes the operational management functions involved in running the business of the covered entity. For disclosure of PHI for any other purpose, the covered entity must have the patient's permission. The patient must give permission with the signed authorization. The signed authorization must be specific for the information to be disclosed. Information about substance abuse, STDs, HIV status, and mental health services may not be disclosed without a signed authorization by the patient. Now, there are some exceptions to disclosure limitations, and they are: 1, court orders to release PHI, workers' compensation cases, information required by state laws that has to be released to specific agencies for public health reasons. An example is the requirement that certain communicable diseases be reported to a Department of Health. Self-pay requests. Under high-tech, a patient can restrict the access of health plans to his or her medical record if they pay for services in full at the time of service. De-identified health information may be disclosed without permission. That means that all identifying data concerning the patient must have been removed from the records before disclosure has or can occur. If a breach of PHI occurs, the covered entity must notify the affected patient or patient's kin, if the patient is deceased, of the breach within 60 days of the breach. Business associates must notify covered entities of a breach. If there is a breach of more than 500 patient records, then prominent media outlets must be notified, and the Secretary of Health and Human Services must also be notified. All breaches of less than 500 patients must be reported to the Secretary of Health and Human Services annually. Well, I hope this gives you a basic understanding of PHI. And I hope it helps. Have a good day.